Developing a passion for health at an early age has tremendous benefits. That not only includes an individual who's investing in a lifestyle that values wellness, but the community as a whole.
And helping bolster the ranks of adolescents that care about health is a youth-led, adult-guided program with some important goals. So we are so happy to have with us today Cynthia Schiffler. She is the ATOD Prevention Coordinator with the Wicomico County Health Department. Welcome to the show.
Thank you for having me.
So before we get into ATOD, tell us a little bit about what you do with the Health Department.
Okay, I'm a drug prevention coordinator. So it means I work or try to prevent drug use on most of the drugs. Now there are specifically at the health department, there's a tobacco coordinator, there's also a opioid coordinator. But I tend to focus on the others, which are probably the two biggest drugs that we have in our county are alcohol and marijuana, of course.
Okay, yeah.
Okay, so ATOD is alcohol, tobacco, opioid.
It's alcohol, tobacco, and other drugs.
And other drugs.
drugs.
Okay.
Yes, and other
Gotcha,
drugs.
gotcha.
Okay.
Okay, well, let me ask you about another one, the DART program. What is the DART program and how'd that get started?
Okay, Drug Action Response Team.
Okay.
I didn't come up with the acronym, the youth did, and they came up with the name, because as you said, it's youth-led,
Right.
adult-guided, and they had the opportunity to do that. And we came up with that, I guess, we've been around for over 10 years.
Okay.
But basically it's a youth program. They determine what they're going to focus on, what drugs they're going to focus on, what populations they're going to focus on. I will tell you that most of the time they don't want to focus on their peers because I think they feel uncomfortable probably doing so. But they usually want to educate children,
Yeah.
maybe younger, maybe middle school students, or adults, parents. So I think parents would be more receptive to them because they kind of,
Something they're watching out for anyway.
right. And it's not like me telling them what to do.
Right.
It's a youth pointing out some things that are of concern to them. And how can you be angry with that?
Yeah, no kidding.
No.
You can't be. So
what do you have any specific goals for the program?
well, we just are going to start our first meeting on Wednesday at 4 o'clock. And we have a number of students who've signed up. And we're going to give them an opportunity to, one, get to know each other. We'll do some team building with them, get to know the other peers that are there, have some snacks, make it a little informal, because we are informal. We want them it to be their space
Right.
and to be their focus and get talking about some of the topics and what they would like to learn, what they would like to focus on, because we're kind of broadening the topics to include other things that are related to drugs, like sex education or suicide is a big issue, all those things. And there's a link between drug use and some of those items.
Okay.
Like, for example, most youth do not have sex. They have sex, but it's under the influence of something generally.
Okay. Okay.
So there is a connection, strong connection between some of it, but just mental health. Like the young man before us was talking about mental health. A lot of youth and adults have mental health issues that have been undetected, undiagnosed, and so they turn to drugs to handle that.
So what do you think some of the biggest health issues for this youth, what do you think some of the biggest issues are?
I think probably realizing or accepting the idea that everybody isn't doing it.
Okay.
I think they think, and research has shown that you think everybody is drinking, everybody's using marijuana, everybody's doing whatever it is that's popular. It's not true. It's really a small minority that are doing it. But the perception is that everybody is.
Wow.
And so that's the thing I think that youth need to realize is that they're not alone in their beliefs, because a lot of them don't feel comfortable, don't want to go that route. And that's why I always say DART is not for everybody.
Right.
Some people go, oh, it's for everybody. No, it's not. Because some youth, it's just not for them.
Yeah.
But we're not, if a youth is, I don't know, in trouble with the law, or they're a gang member or whatever, I'm not going to say they can't be part of DART.
Okay.
Because sometimes things like this could change somebody's life.
Yeah.
And they feel important enough or doing something that they're making an impact that they want to continue doing so. So it's open to anyone, but I realize that it's not for everybody. And I tell youth that, because if it's not for you, that's fine. But we're going to provide this opportunity for you. We have a adult coalition, Drug Free Wicomico, and this would be this is a youth coalition now, which is part of it, so they could give feedback to the adult population as well, but also gives us an opportunity to go to like the CAGCA mid-year or the CAGCA forum. They get to be trained and meet youth from all over the country, and which would be a wonderful opportunity.
Yeah.
And meet youth that are very similar to them or have similar likes to them. Because I think it's hard for youth today to find their little niche where they belong.
Right.
Especially when we're looking at middle school and high school. So it's a little
quite
bit
remarkable, I
Yeah,
gotta say.
but the earlier you get them, the longer you have them.
Well, yeah.
So we try to offer it to middle school because there's a little bit more limbo there,
Right,
and trying
right.
to figure out who I am and what do I want to be.
Boy, this is one of those that we could spend all afternoon talking about, isn't it? It really is.
Yeah.
It's amazing.
Well, Cynthia,
Yeah.
we're going to put some information on our website, DelmarvaLife.com, so that folks can reach out, find out
Good.
more, possibly join.
Yeah,
Great.
yeah.
Thank you
Great.
so much.
Well, thank you.
My goodness.